Good afternoon, everybody. My name is Will Cook. I'm the president and CEO of Vail Health. I want to welcome you and thank you for taking time out of your busy schedule today to talk with us about the state of Vail Health. It feels like a lot longer than a year ago that we held our last States of Vail Health. I think that with the global pandemic and the impact that it's had on all of us, time seemed to creep by there for a period of time. But I will tell you, call me a optimist or naive. I do think that this pandemic really made us realize how important it is that we come together as a community to address problems. The collaboration that we experienced with our local governments, our state government, other nonprofits, community members who volunteered their time, stepped up to help out in any ways that they could, have really made me realize just how lucky we are to live in this valley. So thank you for all that you've done during this unprecedented year. Despite all of that, we are excited to tell you a bit about some of the things that took place that weren't related to COVID and some of the things that we look forward to doing as we emerge from this awful pandemic. From a housekeeping perspective, if you have questions, please use the chat function that's at the bottom of your screen on Zoom. We will try to answer your question as we're going through our presentation. If we can't do it then, we will try to get it at the very end. Other than that, I'd really like to get started and introduce you to Craig Cohn, our Chief Real Estate Development Officer, as he's going to give you an exciting update about all that's been happening with the new wing. Craig.
Good afternoon, everyone. Thank you, Will. Thank you all for taking the time to join us today. And certainly we are excited to take you through what we've been working on that unfortunately many of you have not been able to come inside to see just yet. Next slide, please. And next. So from most of your point of view, I think the biggest change aside from the new structure that impacts the public is how you now access the hospital. So after 55 years of entering the hospital on Meadow Drive, while that entrance is still available and will be available for a couple of months while we continue to wrap up construction, the new entrance is on Frontage Road at 180 South Frontage Road, directly across the street from the Vail Municipal Building. So that changes that you will be coming through the roundabout, entering Frontage Road, and coming onto the hospital grounds and right into our parking garage, or dropping a patient off or a family member off right here at the main entrance on Frontage Road. So that will be the biggest change to you as far as coming and going within the property. This building that you see here was almost 10 years in the making, if you can believe it. The West Wing expansion that we completed back in 2017 was a construction project from 2014 through 2017. And this new East Wing expansion with the heli tower on top is a project that started construction in 2018. And while we completed it and opened imaging and the lobby and the emergency department about 6 weeks ago, we are still doing work inside the building, and that work will continue for the next couple of weeks and into the spring. Next slide, please. For those of you that either are fortunate not to be in that upper right room yet, that's our new emergency department, or those of you who have not had an opportunity with COVID to come into some of the main common spaces of the new East Wing, here are some images giving you an idea of the feel and the flavor that you will experience when you do have an opportunity to come into the building and enter the campus. The upper right image that you're looking at is our new emergency department. A lot of significant upgrades from what we had in the previous emergency department. We now have an increase in private rooms from 3 rooms to 12 private rooms. We have increased the number of bathrooms for patients and staff by 4 times within this facility. We have added 3 isolation rooms, and also really excited, we have increased our capacity from 0 behavioral health specific rooms to 3 dedicated behavioral health rooms. Also keep in mind, when those rooms don't need to fill that function, they can still fill a function as a typical emergency department room. So the capacity, the types of patients we can help is greatly expanded within this new state-of-the-art facility. Above all of this is both the Amby District's new home as well as the helipad on the top floor of this new building, where that is really significant for us. It's a huge change in safety, security, and time. So we run about 75 to 85 helicopter trips a year, and we believe now that we have this facility with a gurney-sized elevator that can drop a patient and the staff from that helipad down to the emergency department. We've cut that time per trip by about 30 or 40 minutes and greatly increased the safety. Same goes for the ambulance district, being able to bring their ambulances inside the facility and come right into the back of this ED. Again, saving a lot of valuable time, and in inclement weather, greatly increasing safety as well as privacy for the patients and the staff. As far as our new parking garage, as we've been growing at 575 spaces, we have now more than doubled the amount of parking on campus compared to what we had in the old garage prior to demolition back in 2018. Next slide, please. As far as some things on the horizon, so the next big project to take place from outside is to remove the old ambulance district building, which will help us with more traffic flow and more parking, again, to support all of that traffic coming on and off the frontage road. In addition to that, mid-spring this year, we will be opening 2 additional operating rooms, in addition to another operating room that has already been added and open and in service here on the facility. And then looking into this summer, once the ground thaws out, we will complete a lot of the exterior improvements like landscaping, and getting all of the traffic, as I mentioned, onto Meadow Drive. And that is our overview of what you can expect to see when you have an opportunity to come into the facility. Thank you.
Greg, thank you very much for that update, and more importantly, for all the work that you and the entire team have been doing over these past few years to position us for this. And I'd be remiss if I didn't thank the town of Vail for all that they've done to partner with us on this, as well as many of our neighbors. I know it's been entirely disruptive to have so much construction happening over a prolonged period of time, and we're extremely grateful for your patience and understanding with that, and extremely grateful for all of our benefactors who helped make this dream a reality, and our community members in general who've just been exceptionally patient while we go through this process. And we think now that this valley will have a new facility, state of the art, to last them for decades. And it really doesn't happen without a community pushing and pulling in the same direction. And we're so grateful for your efforts in that regard. I don't think this person needs an introduction, but again, I would feel remiss if I didn't give him a proper introduction, because Chris Lindley was actually hired to run Eagle Valley Behavioral Health, a wholly owned subsidiary of Vail Health, created by our community in our valley to help us address the god-awful crisis that was really affecting so many people. In life, sometimes you say it's better to be lucky than good, and I have to say that I think I got pretty lucky when we hired him, because not only was he really effective in helping us get Eagle Valley Behavioral Health off the ground, but he happened to also be the former director of public health at Eagle County. He used to work for the CDPHE in Denver and the CDC in Atlanta. And when you are on the heels of a pandemic and someone whispers in your ear, hey, Will, this thing that's going on in Wuhan, we probably ought to pay close attention to it. Do you mind if I start preparing? You actually have to listen. And so Chris has not only been the executive director of Eagle Valley Behavioral Health, but he really has helped lead our COVID response. And it's the reason why he's now our chief population health officer. And while I won't attribute us creating Eagle Valley Behavioral Health to luck, that was very deliberate. I will say it was very well timed, because as we've all seen, there's not only the consequences of the virus, but the second order consequences associated with isolation. And having Eagle Valley Behavioral Health in place here, which you'll hear a little bit about a little bit later in my presentation, really couldn't have been better timed. And Chris has had his hands on just about everything we've done with COVID. He ought to have a cape that says Captain America. I'm excited for you to hear from him today. And Chris, on behalf of this entire valley, we thank you for everything that you've done, because I know you're going to say it takes a valley. I know you're going to give credit to everybody else, but it also takes a leader. So thank you. And why don't you give him a COVID-19 update?
Thank you, Will. And what it takes most, though, is a boss and a CEO that puts the community first, the staff first, and lets us do what we need to do. So Will, thank you for 12 months of letting all of us at Vail Health and Colorado Mountain Medical and Howard Head and Shaw Cancer Center do all the things we need to do to protect this community. Next slide, we'll get started. All right, so guys, I want to start off with some good news. It's been 12 months. We've been in this battle with COVID. COVID's not done. It's not done with us. We certainly have more in front of us. But currently, all trends are looking very positive across the United States when you look at the key indicators that we look at. So if you look at hospitalizations, this is national data. Hospitalizations are going down. The number of people that are seeking testing each day, that is going down. That's an indication that there's less people out in the community that are sick. And then also probably the most important measure we look at it, because it's an early indicator, is the percent positivity, and that is declining nicely as well. What that means is of the percentage of people that actually get a COVID-19 test, what percentage of them come back positive. And you can see we are dropping rapidly, and it's just around 5% now, which is fantastic. Next slide. But let's focus on what's going on locally. We have a lot to be proud of. We have a lot to still be optimistic about. At the top of the list, our school district, working with Eagle County Public Health, as well as all the great teachers and parents, have done a remarkable job this year, keeping our kids in-person learning. This is also with our childcare facilities. We are very, very fortunate to have our kids in class in person. Even though we have some modified schedules, we're doing a great job within our schools. And we just want to thank all of our teachers in the school district and leadership and Phil Qualman for just a great job with that. Our healthcare capacity has remained strong this entire time. We've been lucky there as well, but that has been due to a lot of great work, and also the presentation that Craig just gave. A lot of the benefits of having the new East Wing was it freed up some other space within our old facility that allowed us to have robust surge capacity should we have ever needed it. We didn't need it, but we had it there. And it allowed us to really plan aggressively and really get in front of this for whatever could have came down the road. Our outpatient visits, so this is across all of Colorado Mountain Medical as well as urgent care clinics. While we did see some surges in some of the past peaks, remain steady now, and I'll give you the latest data, but everything is strong and looking very good. And then as Will mentioned, we could not be luckier to have a very robust behavioral health system in place. While we're not done with that, we're just getting started. We're just into it, literally 18 months. We have added 50 new providers in the last 12 months, and all those providers are out treating and caring for our community members. And we're really making behavioral health care just like physical health care, where, if you're not going to see a behavioral health provider once a month or once a quarter, we're asking why, as we all need that extra help. And then lastly, which I'll talk about today, is who has been vaccinated so far. Lots of questions in the community. When can I get my shot? When am I next? And those are excellent questions. That's what we want to hear. That's the mentality we want. We want everybody to get a vaccine. We've been really moving fast, working side by side with Eagle County Public Health. We've gotten essentially every healthcare worker in the Valley, all the first responders, and we believe we've gotten most of those that are over 70 that want to get vaccinated. Next slide. Let's look at the data a little bit. I'm not going to spend much time on this, but sometimes a graphic is worth 1,000 words. And you can see, looking all the way back to spring a year ago, that was our original peak. But keep in mind that at that time, we didn't have the robust testing capability that we now have in place. So that peak would have been much larger had we been able to test like we're testing now. But we also had a peak midsummer, right around that 4th of July time and a few weeks after that. And we're just coming through our last big peak. And this was definitely our biggest one. As you can see, we've been plateauing at a high incidence rate for quite some time, but it's clear we're starting to go down locally, and that is some great news. Next slide. Oh, back one. This is our hospitalization data. This is from the Colorado Department of Public Health and Environment. And as we've been talking over this last year, while locally, our healthcare system remained very strong and consistent with a low level of COVID-19 hospitalizations at any one time. That was not the case across the state. And it was something we were all watching daily. It was something we were talking with our other hospital healthcare systems and our partners on the Front Range, as well as the Western Slope, making sure that if the hospitals that we would traditionally transport higher acuity patients to, if we were not able to do that, that we'd have the skill set, equipment, et cetera, here locally to care for those patients here in our community. And we were able to do that. And the great news is, looking today, you can see hospitalizations across the state have already significantly dropped. They're already down to early October numbers, and we hope they continue to go down. Next slide. This is the current, when I say current, this dial framework will actually be changing tomorrow. The governor is making some changes to this and doing some little refinements, but this is the current dial that we've all been looking at when we hear the different levels that we're at. We're currently in the orange level, and we've been there for quite some time. So even though our incidence rate has put us in the red, the other two measures have kept us in the orange level. Our 7-day average positivity rate is right around 7.8%. And the one measure that has stayed the most stable and has really helped lock us into these lower levels has been our hospitalization data from Vail Health. And that's been consistent around 3 patients per day. Now, this will change tomorrow. And I want to just talk briefly about some of those changes because it does make a big difference. One of the changes is currently we look at a 2-week incidence per 100,000 people. In the new dial that will be released tomorrow, they're going to actually look at a 1-week incidence, 7 days. And what that will do is, for example, tomorrow, our 1-week incidence, if everything remains the same, will be around 330 per 100,000 versus our 2-week, which is now 664, which you can see there to the right in the red box. However, the incidence rates in each one of these dial measures is going to stay the same or actually increase on the upper end. And so the take-home message means is what's going to happen is for each one of these levels, there's about 140 to a 200% increase in scope of the incidence rates that fits in there. So in the very near future, Eagle County could certainly be qualified to move into the new yellow category when that comes out. And we'll be sharing a lot of information over the next few days about that as well, Eagle County Public Health. But just wanted you guys to know that these measures are changing, and once they get finalized, we'll share all that information with all of you. Next slide. This is our dashboard that we look at literally every day, and you can see all the key measures. I'm not going to go through all of these, but I just want to highlight a few things that definitely need to be called out. The one I want to first focus on is the days that it takes to get scheduled for a COVID-19 test. This is extraordinary. With the great work of Colorado Mountain Medical, the Vail Health Laboratory, partners in the community that are working with us, our local public health department, it's now less than a day across our community to actually get scheduled to get a test. And I'll show you how to do that a little bit later in this presentation. And then even more importantly, to get those results, all of our results are now less than 12 hours. And as you can see, our goal was to get it less than 24 hours, but we're now less than 12 hours across the system. And I think in most cases, it's closer to 8. Our sick clinic volumes across Colorado Mountain Medical remain stable and low, around 40 per day. We have great PPE on hand. And probably the most important measure for us is making sure our staff are healthy and that they're coming to work and they're able to do their job and they're here for the community. And today, we only have 3 people that are out on isolation and quarantine. But I want to note that literally the day before we started our staff vaccination efforts, which was just 6 weeks ago, we had close to 30 employees out on this. So the vaccines are working, they're highly effective, and have made a huge difference in our organization for keeping our staff at work. And we're excited to see that happen for all the other employers and all the other organizations across the community as soon as we can get more vaccines in this community. Next slide. This is just to highlight that testing data. Our lab has has done an amazing job. Our testers at our 7 testing sites have done an amazing job. But really what this graph on the left shows is really how our capacity to do testing continues to increase. And you can see it's almost a linear growth really since the beginning of September that we've been increasing capacity. As of now, in our valley, as well as the testing that we're supporting, not only in the Roaring Fork Valley, but also in Summit County, we do all tests in-house. Those are all done either on-site through a point of care test, or they go to our Vail Health laboratory where they're run in, as I mentioned, less than 12 hours and reported back to our community. This is a great capacity because it ensures we control the flow, we control the speed, and we can get those results back in a timely fashion. Still today on the Front Range, people are waiting 2 or 3 days to get their results. And as you can see, we've done over 46,000 COVID-19 tests in the last year. That's a lot of tests. And we are prepared to do as many, if not more, over the next year as we continue to move forward. Next slide. This is just a graphic that shows all the different testing locations. And I just want to remind everybody on the phone, if you're wanting to get a COVID-19 test, and or if you have any questions about vaccinations, all you have to do is go to vailhealth.org. A pop-up pops up right when you go there, and you can click on testing information and or vaccination information. And everything I have on this slide is there as well. Next slide. So let's talk about the vaccine. Collectively, Eagle County Public Health and Vail Health have been able to administer more than 9,000 vaccinations today. This is a credible effort in just over 6.5, 7 weeks. Vail Health has administered over 70% of these vaccinations to date, but the county is quickly adding on big vaccination clinics or points of distribution. And so you'll see these numbers even out as we go forward into the future. We're working side by side to ensure we get every vaccine out as quickly as we can. We're excited to report that 93% of our employees that are eligible to get vaccinated have already gotten vaccinated. This is a great uptake. The employees across the entire organization were very eager to get the vaccine, and we've all done it. And we're happy to report, while you might have some minor side effects the day after your second dose, you might feel a little crummy for a day. It's much better than getting COVID or sharing COVID with a loved one. One point I want to highlight about vaccination efforts, a lot of questions about, vaccinating our neighbors. Maybe it's to Lake County up in Leadville or Summit County or someone from Denver versus just focusing those vaccinations only on Eagle County residents. And the guidance to us as a healthcare entity, as a hospital is, you vaccinate anybody that's a Colorado resident and or property owner, as long as they fit within the defined categories that we're in. That's what we've been doing, and that's what we're going to continue to do. And we will continue to, as supply increase, work with Eagle County to administer as many doses as quickly as we can. And then also we are keeping in mind that as we go forward, we're ensuring that we can provide the second dose in the time frame that it was identified with the emergency use authorization. So with Pfizer, it's 21 days, you'll be getting your second dose. And with Moderna, it's 28 days, you'll be getting your second dose. So while there's national discussion, international discussion about postponing those second doses, that's not something we're doing here. We're getting everybody those second doses within that time frame. Next slide. This is the new COVID-19 vaccine distribution chart. This literally just came out in the last 48 hours from CDPHE. We used to have phase 1, phase 2, phase 3, but as you can see now, phase 1 has actually dropped into a few more categories. I'm not going to read through this whole chart, but the takeaways are this. Starting next week, February 8th, anyone who is 65 and older and or as well an educator in pre-K, so kindergarten through high school, is eligible to get a vaccine. So if you're over 65 and older, or you're an educator in our valley, starting next week on February 8th, you will be eligible to get a vaccine. That does not mean you will get a vaccine next week. We are going to push out as many vaccines as we have available, but we will not have enough vaccines the first week to get everybody that wants one. But we will continue to work with Eagle County Public Health, and we will work with the Colorado Department of Public Health and Environment, requesting the max amount of vaccine we can every single week. And we will move those vaccines as quickly as we can. But we're very excited to announce that starting next week, those 2 groups are going to open. We've also learned from the governor's office that as soon as March 5th, so just 1 month from now, frontline workers and Coloradans age 16 to 64 that have 2 or more high-risk conditions will be eligible. But those frontline workers, that includes those that are working in the restaurant industry. That is also great news because that is a huge segment of our population and is also a vital component of our economy. So we are really looking forward to opening up that category as well. But again, these things will all be contingent in terms of our time of rollout will be fully based on vaccine availability. Next slide. So how do you sign up? You don't sign up by contacting Vail Health. You're actually going to sign up by contacting Eagle County, and I have the website there. It's eaglecountycovid.org. We are working with them every day. We want everybody who is eligible. So if you're in that 65-year and older category and or you're an educator, we want you going to their vaccination request form that you can find on that form. We have an example of what it looks like, and filling that out. And they, through a lottery process and through a prioritization process, will notify us which folks are eligible, and we'll reach out to those folks with the county and schedule those for a Vail Health clinic. And the county's doing the same thing for scheduling them for a county clinic, which will be down valley at maybe one of the high schools or the fairgrounds, wherever they're putting on the clinic at the time. But all of our clinics will be held at the Vail Health old ED on the main campus. But again, I want to stress, if you're wanting to get on the list and you are in fact going to be eligible next week, so those are those 65 and older, healthcare workers, first responders, obviously the previous group 70 and older, and the new addition of the educators, sign up online with Eagle County Public Health, and we will work with them for sure to make sure we get you a vaccination as soon as we can. Please do not come to the vaccination clinics, both the Vail Health vaccination clinics and the county vaccination clinics, thinking at the end of the day you're going to be able to get one of those vaccines that's left over. We are scheduling them down to the specific dose now, and we are not going to have any vaccines left over each day. So we'd hate for people to make the drive and wait to try to get that vaccine when the reality is we're not going to have those vaccines for anybody at the end of the day. So the clinics, both Eagle County clinics and Vail Health clinics are appointment only. And if you've got a scheduled appointment, we'll have a vaccine for you. Next slide. So COVID is not going away. This is the, started off with a lot of optimism and, we're doing very good. We all need to remain aware of what's going on. I'm sure many of you have heard the news. There's multiple variants of concern worldwide. Specifically, the 4 that we're most concerned with is the UK variant, South African, Brazil, and a California variant. We have obviously seen the California variant here. It emerged in California. But the UK variant and the South African variant have now been also found in the United States, both of which not only appear to be more infectious, they transmit more readily, but also more severe, with specific concern with the South African variant, which appears to have some resistance, I say some resistance, to the current vaccine. That doesn't mean that the vaccines are not effective against this. They still are effective. There's just a little bit more resistance than the traditional vaccines. So even though that these variants, all of them might not cause more severe disease, it's important for us to realize that as the volume of cases stays high and continues to spread with a more infectious variant, that we're going to see more morbidity and mortality. So even if the percentage of the population that gets hospitalized and or dies due to COVID-19 is exactly the same. If more people are getting infected with it, those numbers increase. So we could certainly see an increase in illness, an increase in hospitalization, an increase in death as we go into spring if we don't stay in control of where we're at and control of this virus.
Chris, just 1 second, just because there was a question earlier and I was waiting, having seen these slides before, someone had said, things are looking so good, nationwide and statewide and even valley-wide with regard to, the hospital systems not being overwhelmed. Why are we hearing from the federal government that we've got a dark 90 days ahead? And I just wanted to put a point on that because this really is the answer. It's that the combination of these variants, which, the more and more this virus mutates, the more likely it is that it could figure out a way to get around the vaccine. And so this race between trying to get enough vaccines approved and then ultimately produced and then distributed and put into arms is being done in the context of these mutations that are taking place. And of course, we're all trying to get to the warm weather as well, where it's more difficult for the virus to mutate. But I think what we've got is, by this summer, we should have a large percentage of our population vaccinated. We should be back to the warmer weather. And hopefully we'll have had enough time for all of these drug manufacturers to also do what they're already started, which is figuring out what the next vaccine looks like, as we all probably will have to get a booster shot of this at some point in the fall or maybe next winter. So that's why it maybe sometimes feels like conflicting messages of, oh, you're saying things will look positive, but we're hearing President Biden say it's going to be a dark 90 days. And hopefully that answered your question. Sorry.
Thank you. That was a great point. And just to follow up with Will's comment, this is something we all have to, find a way to kind of wrap our mind around it. And that is COVID-19 is never, in my opinion, never going away. We're going to continue to live with it and deal with it for generations to come. It'll be like seasonal influenza, but like seasonal influenza, we'll have updated vaccinations, as Will mentioned, updated boosters, better treatments. We'll know how to control it better. But this is a highly infectious disease that has already spread around the entire globe, is well established, and to completely eradicate it is probably a fallacy at this point, but we can control it in our community by reaching herd immunity and getting to that 70, 80% vaccination rate where we will still have a few occasional cases, but it won't be shutting down our economy and shutting down our schools and changing our way of life, hopefully, in the future. Next slide.
And I think to that end, to answer another question that come about, hey, was there ever a moment when Vail Health's patient care unit or its intensive care unit beds were reaching capacity such that we were in danger? And I think the answer to that is no, in large part because we had created surge capacity. But I want to make sure you understand it's not just about Vail Health's beds. It's about the overall state of the healthcare system in our state, because there are certain services we just can't safely provide here, especially not at this altitude. And when you've got a virus that's affecting someone's breathing, as an example, they need to go to a higher level of care in Denver. So we're attached to Denver or Grand Junction or wherever these higher levels of care are. And so you'll hear a lot of things out there about how do they protect the healthcare system, because if people can't get to the level of care that they need, the quality and standard of care drops, and that's when the case fatality rate goes up. So we're very proud of the fact that we were able to get out in front of this and stay out in front of it, but we have to think about the entire state. And I hope that answered the other person's question as well.
Thank you, Will. One more slide, please, Christine. And so what do we need to do? We need to keep wearing our mask. And I want everybody to know that you're going to continue to hear the messaging of masks, and they're going to continue to be mandated. They absolutely work. If anybody has questions if masks are effective in slowing the transmission of disease, just look at our seasonal influenza rates across not only Colorado, our valley, but the entire world, rates are the lowest they've ever been. That's because masks are effective of keeping our respiratory droplets confined. However, as we look at these new variants, they are more transmissible. So think about, if you can, maybe upgrading your mask. If you're not wearing a medical grade mask like the surgical masks that you can now buy at almost any grocery store, as well as Walmart and Home Depot, if you can get one of those, definitely wear it. If you're still wearing a cloth mask, no problem at all. But make sure when you hold it up to the light, you can't see through it. So if it's one of those very thin cloth masks, maybe upgrade and get something a little thicker just to give you a little bit more protection. Make sure you're getting tested. If you are sick, we want you to get tested immediately. We have 7 testing sites throughout the Valley. There's no limit to the amount of testing you can get, and every test is free. And as I mentioned, if you want to get tested, please go to the Vail Health website. It'll pop up with a little link there to click on how to sign up to get a test, and we'll get you tested within the next 24 hours and get your results right away. If you're sick, or if you've been around someone who is sick, we still need to isolate and quarantine. This is the most effective way of controlling the transmission of the virus, is those that get it not infecting others, and certainly not infecting others that might have a immunocompromised system or any other risk factor. So if you've been exposed to someone who's sick, or if you're sick, definitely quarantine and isolate yourself, get tested. And if public health calls for contact tracing, call them back. That is great work that they're doing to ensure that anybody that might have been exposed to someone that's contagious is notified, so they can take the proper precautions to not only take care of themselves, but protect others that are around. And last and not least, get vaccinated as soon as you can. Again, the great news in this valley is people want to get vaccinated. We have a long line of people that want to get vaccinated every day. We will get people vaccinated as quickly as we can. And as Will mentioned, we are hoping by summer we'll get through everybody that wants the vaccine in this community, but we're just going to have to remain patient as we work through the prioritization groups, as well as supply continues to ramp up. Thank you.
Chris, another question that came up was, if you've recently had COVID, do you still have immunity against the new variants? For example, if I've heard that you've had COVID recently, that you should have immunity for up to 90 days. Could you speak to that?
Yeah, I would love to. So we do know that, I'm going to address this in 2 ways. We do know that with what I would say traditional COVID, the COVID that we've been dealing with over the last 12 months, that immunity does wane. We have seen multiple incidents of reinfection, not only in this community, but across the state, where people had got it in spring of 2020 and then got it again in fall of 2020. So we do know that natural immunity wanes with COVID-19. And what we've learned looking to South America, specifically in Brazil, with the Brazilian strain, to talk specifically about this variant, is one of the communities down there that was actually one of the most hard-hit communities in the entire world, that had the highest death rates seen anywhere and the highest number of folks that were actually infected and the highest incidence rates. They had thought, traditional epidemiologists and care providers thought after that community would have great immunity going forward. And unfortunately, what we're seeing is with the new Brazilian strain is directly targeting that same community again. And this time they're seeing the same level of death and hospitalizations that they saw previously. So there is definitely some worry that the new Brazilian strain evades some of the natural immunity that you would have had with older strains. The good news is the vaccines don't just target one specific thing. They provide a whole spectrum of immunity, and both vaccines still provide protection against the Brazilian strain, the South African strain, the California strain, and the UK strain.
Great. Okay, so I think that there's a couple of other questions. Like someone had asked, Chris, when do we think we'll get to herd immunity in Eagle County, especially in the context of waning natural immunity via being exposed before? You want to answer that one real quick, and then also how the vaccine supply situation looks to us before I move on to the accomplishments and goals for next year?
Absolutely, Will. We are sure hoping we get there by summer. If the projections we've heard from the federal government and the state of vaccine rollout continue, we are confident that we'll get 70, 80% of our community vaccinated sometime this summer. And then, I'm sorry, what was the other question, Will? Sorry.
That's all right. How does the vaccine supply situation look to you?
Great, thank you. It's looking better every day. The federal government is making larger purchases of both Moderna and Pfizer. We also have a third vaccine that's very close to being approved. That's the Johnson & Johnson vaccine. That will be a single-dose vaccine. And so as more vaccines come onto market and we are able to get more of the current ones we're using, we're going to have more of an arsenal ahead of us. So things are improving.
Great. And there was one last question I think I can answer. It said, how long will immunity last after the vaccine? And unfortunately, it's not known exactly. It's almost like the seasonal influenza, as Chris said before, that, we're going to be living with SARS and COVID-19 or mutations of it for a period of time. And, as it mutates, the drug manufacturers, working with scientists, will have to ultimately come up with updated vaccines. So it's not out of the realm of possibility that we work like heck to get these vaccines in by the summer, and then we may have to be doing a booster shot in the fall. So more to come on that. They're studying it feverishly, but I'll tell you, in summary, our best pathway out of this is through the vaccine. Until that time, it's what it has been this entire time, which is please continue to be vigilant about wearing your masks, socially distancing, being mindful of when you're not feeling well, and all of those things that have really helped us thus far in this fight. And I'd be remiss before we moved on if I didn't give a special shout out to Heath Harmon, our Director of Public Health here in Eagle County, and Jeff Schroll and really the Eagle County Commissioners, their entire team. They have been a partner like nobody else. The state has been wonderful to us, and we're so grateful for everything that they've done to help us with it. And we'll look forward to keeping you all updated on what's happening here as it relates to COVID. But if you don't mind, I'd like to move on and tell you a little bit about what's been accomplished despite COVID, and then talk to you a little bit about where our areas of focus are. I'm going to ask Chris and or Chad to monitor some of the questions that come up, and what the slides say. If I'm going to cover it later, we can get it that way, but prompt me if I need to stop and answer a question. So a 2020 recap. Despite everything that was going on with COVID, and despite everything that was happening with the East Wing and some growth in new markets, as well as me being into my second year and turning over the senior management team, I wanted to make you aware of what we're most proud of, which is we've continued to keep our eye on the most important ball that's in the air, which is how do we provide the highest quality of care and the highest level of patient experience to everybody we serve. Do we get it right every time? No. Are we trying to get it right every time? Absolutely. And some of the awards I've listed out here for you are not just awards that happen, to everybody. For Vail Health to return to an A and leapfrog after experiencing a significant drop down, that wasn't by happenstance. It was by focused efforts on doing the things that we need to do to reduce infections, reduce falls, and ensure that we're providing a safe environment for patients who receive care here. We were actually one of 6 hospitals in the state of Colorado to receive a Press Ganey Guarding of Excellence Award. In essence, what it means is we were in the 95th percentile or greater for 12 consecutive months for people rating us as having received good service while here. We were the only cancer center in Colorado, and only one out of 49, and there's 1,500 in the country, cancer centers to receive the Outstanding Achievement Award. This is the Shaw Cancer Center. And so many people associate Vail Health with orthopedics, and they should, because we are medical destination there. We're very proud of it. But I'm also very proud of all that we do with oncology. We have some of the best cancer survival rates for breast and prostate. And when you come to the Shaw Cancer Center, we treat you as a person holistically. Couldn't be prouder of that team, and I think this award recognizes that. The American Hospital Association gave us the NOVA Award for the Eagle Valley Behavioral Health Impact on Community Health. We were one of 5 in the U.S. to receive it. We have a 4-star rating and have since its inception. And I bring all this up not to be braggadocious, but rather to help you understand that this community is blessed to have an asset like this that's being recognized on local, national, international stages. And it doesn't happen, again, without a visionary board, a capable management team, and a very supportive community. So you all should be proud of this, because this is part of your accomplishment as well. Next slide. So I'm not going to read through every one of these, but suffice it to say that One of the areas we're always focusing on is infections, especially since we do so many surgeries. And I'm trying to dig into now the science to understand how much of this is related to the fact that so many of us have been wearing masks and washing our hands. If there's a positive to some of the things that have happened with COVID, think back to how many colds or the flu that you may have had from 2019 versus what's happened in 2020. So putting aside political differences, the bottom line on it all is the stuff that everybody's doing by wearing masks and washing hands and being more vigilant really does have an impact, not just with helping control the spread of coronavirus, but with other things that we deal with here in hospital settings. But again, this doesn't happen without a wonderful set of providers and staff really staying focused on it. Next slide, please. I wish we had more time to talk about Eagle Valley Behavioral Health, and I wish Chris could go through in great detail all the wonderful things that have been happening in that space. Again, just to remind everyone, this all started when this community said enough is enough, when one of our own employees' daughters took her own life. And that was a heartbreaking moment for so many people. And when providers and law enforcement and social services and so many people got together to say, what do we have to do to stop this? That's what started Eagle Valley Behavioral Health. It's a wholly owned subsidiary of Vail Health, and it's funded by us. $60 million over a 10-year period, going to raise another $100 million. But man, it couldn't have happened without this entire community coming together. And one of the big initiatives was, how do we hire more behavioral health providers? So what is that? It's a psychiatrist, it's a psychologist, it's a behavioral health therapist, it's a social worker. All of these people were required to come together to provide behavioral health. Colorado ranked, I want to say 42nd in the state in terms of the number of behavioral health providers per capita. And just to get up to the Colorado average here in this valley, we would have had to have added 50 providers, 50. Well, I'm proud to report to you that we've already added 40 in 1 year's time in the middle of a pandemic. And this, again, isn't bragging. It's telling you how focused we are on this. And really, again, as I said earlier in the presentation, it's a good thing we did, because if you've seen the demand for behavioral health, you'll see how it continues to grow in an exponential curve. All this, continued isolation, which is necessary to control the virus, has a second order consequence that manifests itself in behavioral health issues, whether or not that's mental health, substance abuse, what have you. So I'm so grateful for all of our partners, Eagle County, the state, so many of you out there who've helped us achieve this dream. When you think about, as an example, Hope Crisis Response that sends with a paramedic, a behavioral health therapist to someone's home who's having some sort of episode. And rather than have them come back to our emergency department and sit in the back of our emergency room for about 3 days while we try to find an inpatient unit to send them to, only to have them come back to the valley, not have enough providers to give them a warm handoff, the problem festers, and then we repeat process. Not only is that highly ineffective from a clinical perspective, it's incredibly expensive. So when we talk about Eagle Valley Behavioral Health and inevitably population health and trying to enhance access to more affordable care, all of these things are interrelated, and they're very much, part of a strategic plan that we have here at the healthcare system, including merging with Colorado Mountain Medical, where we took a lot of these 40 behavioral health providers and integrated them into primary care and integrated them into the schools and have them now at the jail. It's all about getting upstream to these problems, which when you do that, it not only helps prolong people's healthy lifestyles and keep them from getting sick, it also costs less money. So I could talk on and on and on about this, but I really want to call out Olivia's fund. Olivia was the name of the young lady who took her life. That fund was created so that financial barriers would not prevent someone from getting access to care. And with all that's going on with COVID and so many other tragedies in our community, please make sure you know that this resource is available. Next slide, please. So enhancing access to more affordable care, as you heard me say before, it's all about how do we remove this barrier that health insurance is too expensive or that my out-of-pocket is too much. And that's not the health insurance company's faults. Not alone. Healthcare systems own a big piece of this. Pharmaceutical companies own a piece of this. Medical device companies own a piece of this. Everybody's played their part in it. But the bottom line on it all is, as great as it is to live in these mountains, and as great as it is to call this community our home, it's tough living. Housing is expensive. Childcare is hard to find. Throw in the fact that healthcare is unattainable in many instances, and that could be the thing that makes someone either choose to stay and not have health insurance or leave. When you think about the fact that the state average for uninsured is 6% and it's 16% in this valley, that's a problem. So we were in the process of trying to address this, and I want to give a special shout out to Chris Romer from the Vail Valley Partnership, who, as many of you know, has been trying to work on a healthcare insurance solution that's more affordable for the better part of probably 5, maybe 10 years, Chris. I'm not sure, but I know you've learned more than you probably ever wanted to related to health insurance. But a team of us got together with Chris, including some of the local health insurance brokers, who've been wonderful partners, by the way, to figure out ways that we can try and make not only premiums more affordable, but out-of-pocket expenses, which include deductibles and co-pays and co-insurance. So we created something called Mountain Healthcare Coalition that allows us to do that. We worked with Anthem, which is the local Blue Cross Blue Shield health insurance company, to give them lower rates and to work on ways that we can have patients use healthcare in more effective and less expensive ways. For example, that behavioral health example I gave you. And they created a Mountain Enhanced Network option that is in our valley. It's over in Summit County. It's in some other places in Colorado to try and help people get insurance for something that's a little more affordable. We've got a lot of work to do there. COVID actually put some of this work over on the side for a bit of time, but we are still focused on it and actually getting that work going again. We heard a lot of people say, hey, Will, I fall on the mountain, I wreck my bike, I go to try and get an MRI and it costs $2,000. I can go to, Glenwood and get it for less than $1,000. I'll go down to Denver. We did a lot of things related to adjusting our prices for what we refer to as shoppable services, so that when someone does need to get care, that doesn't become a barrier. I'm not going to read through each one of these slides, but the bottom line on it all is, as a result of doing this, we've seen our volume go up. So it's actually helped us offset some of the losses associated with lowering our rates by, having people who heretofore were going to Denver to stay here in the Eagle River Valley. These are the sort of things that we're going to continue to focus on as we try to tackle this big problem of enhancing access to more affordable care. Next slide, please. Colorado Mountain Medical, probably the most important thing besides Eagle Valley Behavioral Health that we've done strategically. CMM has, at the time, it had 33 providers, predominantly primary care, but some wonderful specialty care as well. And we can't even begin to integrate behavioral health with primary care, or try to get upstream to illness, or try to focus on wellness and prevention if you don't have the physicians to do it. And if Vail Health would have went out and tried to create those physicians on its own or hire new physicians in, it would have been incredibly costly. So we're so excited to have them as part of the family. They've been a huge part of what we've been working on, including the COVID response. They're a wonderful group of doctors, and we've already seen that group grow from about 34 providers to 55. That's about a 62% increase. And they have been on the front lines with COVID and setting up sick clinics and doing testing, and have been a huge partner with Castle Peak. They've really been pivotal in so much that we've done. I couldn't be happier or more proud of Colorado Mountain Medical. Next slide, please. We've actually been focusing on growing our oncology service line. Again, we're trying to find those things that we can and should provide in this valley to prevent people from having to go through passes and navigate difficult storms and deal with taking off work. And while Shaw Cancer Center has been very successful for many years, we were excited to welcome Dr. Julie Barone, a new fellowship-trained breast surgeon from St. Joseph Hospital in Denver. We've actually been working on enhancing our urologic cancer program. Dr. Connie Wolf has been doing some amazing things with her MRI fusion biopsy program. We've been partnering with Dr. Clay Pendleton, who can do minimally invasive radical prostatectomies. We added a new OR in our hospital and put the Da Vinci robot in it, which actually facilitates those sorts of procedures. And we're going to be coming up with a 3T solution for an MRI so that people don't have to go to Denver to get that as well. And most importantly, we've grown the number of patients on clinical trials by 25% year over year. We've grown radiation oncology visit volumes, which is extremely important because people then aren't again having to travel up and down I-70 to receive that care. Next slide, please. I would be remiss if I didn't mention the foundation. Dan Pennington and his entire team are remarkable. They just finished a $100 million campaign as I was arriving, and then gladly took on the challenge to do another $100 million campaign for Eagle Valley Behavioral Health. Thanks to the unbelievable generosity of this community, we've already raised $29 million, and we look forward to achieving the rest of our goal there. We've got a long way to go, and we've got a lot of work to do, including building out a facility here for this valley so that people don't have to leave to receive inpatient care. So many thanks to all of you who've given to that, and I ask you to please consider giving to it as we move forward. But huge kudos to Dan and his team. Next slide. Financial performance, because I know I'm running out of time here, but I want to make sure you understand it was about a $30 million impact from COVID. Between the testing and the impact of the ski season being abridged and all of the things that we've been working on, trying to do vaccination clinics, having the freezers, et cetera, et cetera. But that is our responsibility as a nonprofit organization, to give back to the community that we serve, not just through Eagle Valley Behavioral Health and trying to enhance access to more affordable care, but when a crisis comes like COVID, we're supposed to be there. And I feel we have been there, and I'm so proud of the team and grateful for the community's support as we've all worked together to make that happen. And despite this $30 million hit, I was pleased when S&P affirmed our A+ bond rating, and that's in large part due to the financial strength of this organization. And we'll continue to make sure that we stay strong financially so that we have the means to do something like Eagle Valley Behavioral Health and to have a COVID response the way that we have. Our challenge now is how do we make it more affordable for people so that that isn't a barrier for them to receive the care that they need. Next slide. So our 2021 focus, and I'm going to go very fast here so we end on time. We're going to continue to stay focused on ways that, next slide please, ways that we can navigate COVID, both in testing and vaccinations. We're going to continue to grow local and regional healthcare services. We're very proud to be enhancing our footprint into Summit County and doing more in Roaring Fork Valley. They've been wonderful partners there. How do we make healthcare more affordable? How do we continue to ensure that we have behavioral health solutions that are effective? And when I say population health, again, it's how do we get upstream to problems? How do we figure out ways to manage chronic diseases better and focus on wellness to try and keep people active and healthy? Next slide, please. The Da Vinci robot is related again to the highest level of technology here in your backyard. Next slide, please. This is a rendering of the Dillon Health Center that will happen in Summit County. We're very excited about that. An ambulatory surgery center, urgent care, primary care, enhanced oncology services. Again, thank you to Summit County, who's been so welcoming to us thus far. We've been there for decades, long before Centura was there, and we'll continue to be there for decades. We look forward to figuring out ways that we can address some of the same problems in your county as we've been addressing over in Eagle County. Next slide, please. Roaring Fork Valley, again, this is another partnership that we've been working on with Aspen Valley Hospital and Stedman Clinic to see how we can help them with medical destination orthopedics and medical tourism, and also in ways that we can enhance behavioral health services and make healthcare more affordable. Dave Ressler, the CEO there, has been doing a phenomenal job with that, and we look forward to working with them in the Roaring Fork Valley. Next slide, please. Whew. I think I'm right at 3 o'clock. I think I have 2 minutes, and I saw a couple of chat questions pop up. I'm sorry I had to go fast, but I wanted to leave time for both Craig and Chris to get through their presentation. Questions that I see are coming up. Is there anything that we could answer that I missed, Chad or Chris?
No, Will, I think you covered it well.
Well, let me just say this as we look to conclude this. And I'm looking at my phone because people are texting me with questions and I'm wanting to make sure I don't miss anything here. We don't need State of Vail Health for you all to know what's going on here at our organization. We will open up our time and make ourselves available to anyone who asks. We want to make sure we continue to be great partners in all that we do. As you can see, when we come together as a community, there's nothing we can't handle. And if you want myself or anyone from my team to come and present to you, to update you on what we're doing, or to see how we might help, please don't hesitate to reach out to me. My email address is will.cook, C-O-O-K, @vailhealth.org. We're so grateful for everything that we've learned this year and for all that you've done to position us to be your community partner. We thank you so much, and we wish you safety. We encourage you to get the vaccine, to continue to be vigilant with wearing masks. And most importantly, let's get back to living our normal lives. Let's finish this thing strong. We will get through this, I assure you. And we can get back to trying to solve the other problems we have, like behavioral health and enhancing access to more affordable care and keeping people healthy. So God bless you. Thank you very much for everything. We appreciate you greatly. Take care.